Mr. Speaker, my ministry and department is taking a concerted effort and a strategic approach to improve access to health services and address the challenges affecting provision of health care to the people of Bougainville. As we all know, health is one of the core priorities of government that contributes to enhancing quality of life. The department delivers a number of key health programs based on its strategies and annual work plans. These programs form the core of the health system, and each of them contributes to the functionality of the health services. There are 7 core programs, and these include the following. 1, disease control. 2, family health services. 3, environmental health. 4, health promotion and prevention. 5, medical supplies management and distribution. 6, hospitals, clinical services. 7, health infrastructures. Mr. Speaker, there are 2 district hospitals, Buka and Arawa, 40 rural health services, and 187 aid posts across Bougainville. All health centers are open, while only 83 aid posts are open. The other 8 posts are closed due to remoteness, no proper road access, and no healthcare workers. The technical team is conducting assessment with the aim to open 8 posts in strategic locations that have been closed and will rehabilitate and open them with funding allocated in the 2024 budget. Mr. Speaker, the department structure was designed and implemented with a total of 1,060 positions, of which only 375 positions have been recruited and filled to date. The department could not recruit due to freeze on recruitment in 2019 by DPM, and no funding for DPMS to recruit additional positions. In February 2024, the department submitted to DPMS another list of 141 health workers who are working but are not on pay to engage them on short-term contracts. This is an effort to fill the vacant positions and replace those that were retired and increase the health workforce, of which 43 were retired in 2022 and 2023, affecting the total health workforce. Mr. Speaker, since I was appointed 12 months ago, my priority is to improve access and delivery of health services to the rural population through the department network of health facilities. The ABG Strategic Development Plan 2023 to 2027 has articulated in its social sector development plan the need to improve basic healthcare indicators by increasing access to healthcare in rural areas. The department's 2024 implementation plan focuses on interventions that are aimed at addressing the following: increasing immunization coverage, increasing facility beds, increasing antenatal coverage, increasing access to and update of family planning, increasing percentage months with adequate medical supplies, improving access to basic primary health care, improving standard of health infrastructures, strengthen integrated outreach activities in rural areas. Mr. Speaker, in order to support the above initiatives, the department has developed a health strategic plan 2023 to 2027 and corporate plan 2023 to 2025. The primary purpose of these plans is to provide a roadmap for the provision and further development of health services in the districts across Bougainville. The plans guide the department to work with the stakeholders to deliver essential health services across the region in line with the vision to strengthen primary health care for all. Mr. Speaker, there is increasing demand for health services as the population increases. The latest estimates by the National Statistics Office indicates that the population of Bougainville has increased to 641,000 population. This is having a negative impact on the level of service due to staff shortage as more health workers are retired and retrenched annually. The Sector Performance Annual Review SPAR report of 2022 shows that the health worker to patient ratio is 3 to 10,000. This means that there are only 3 health workers available to serve 10,000 people in a given time per year. This is incredibly low, and the department is pushing DPMS to recruit more health workers. Mr. Speaker, it must be noted that the funding support to the sector has been stable over the last 5 years with only marginal increase. In 2023, the department received a total allocation of 3.6 million, of which 2.2 million was for current expenditure and 1.4 million health functional grants. This year, the allocation for health is 3.1, which is 3.1 million, which is a reduction in budget allocation for the operations of health facilities. Mr. Speaker, the health services infrastructure has deteriorated over the years through natural wear and tear, and it is our intention to bring it back to strength. We are rehabilitating and rebuilding our health facilities so that all our population have access to health service. This rebuild focus on rural health facilities, health training schools, hospital facilities in the 3 regions. My ministry and department focuses on increasing access and improve quality, and this will be achieved through compliance and adherence to the National Health Service Standards. Mr. Speaker, the department received an additional allocation of 5.3 million in the development budget this year to cater for projects including procurement of medical supplies and rehabilitation of 8 posts. The department is also prioritizing rehabilitation of existing health centers with unspent funds from 2023 budget. The department greatly appreciates the executive government for this additional funding allocation. Mr. Speaker, delivery of health services is challenging as the department delivers various programs and projects with limited resources. These include public health programs, hospital services, infrastructure projects, and other cross-cutting programs. Mr. Speaker, the department is delivering a non-communicable diseases screening program. The department is implementing the 10,000 toes screening program with funding support from Digital Foundation. The World Health Organization is providing technical support while the SDA health partner under the Bougainville mission is implementing the screening program. The 10,000 toes is a program that assesses and screens adults for risk factors for non-communicable diseases such as elevated blood pressure, elevated glucose level, obesity, and refer those with risk factors for appropriate treatment. The program is currently implemented in North Nasioy and Rao constituencies in Central. The program will be expanded to North and South Bougainville this year with the ABG funding allocation in this year's budget. Mr. Speaker, the department is leading the implementation of environmental health and WAS programs. A WAS policy and implementation strategy has been developed by the department with technical support from European Union. The strategy 2024 to 2028 will be implemented from March onwards for the next 5 years. This includes providing safe and clean water and sanitation to health facilities, schools, and communities across Bougainville. As part of this program, a team of engineers, technical experts from Water PNG visited Arop from 7th to the 11th of March and did feasibility assessment of Araba town water supply. The team will return in the near future to do assessment for Buka and Buin towns. The department is working with technical services to deliver other WAS projects in the local constituencies. Mr. Speaker, my ministry and department is doing all we can to address the medical supplies issue. The supply of medicines has been problematic due to short supplies from the National Department, which procures medicines. The National Department and the National Procurement Commission does the procurement and distributes to the provinces, who then distributes to the health facilities with support from local contractors. The department has budgeted for medical supplies and will commence procurement of medicines with the funding allocation of 3 million in this year's ABG budget. Mr. Speaker, the Child Health Immunization Program is the heart of the health services, which ensures that children are vaccinated and protected against infectious diseases such as severe forms of tuberculosis, polio, measles, hepatitis. In 2022, the health workers vaccinated over 70% of children under 5 years with external funding support from the PNC Partnership Fund. Data for 2023 are still being analyzed and the results will be available soon. The immunization program is being enhanced and the department has received additional funding from PPF for another 12 months for immunization, which will end in March 2025. The Speaker, emergency management of obstetric care is another critical program intervention that my ministry and department is implementing. The program is targeted at supporting pregnant mothers to safely deliver their babies with minimum complications. The department initiated this critical program in 2022-2023 to train all health workers on how to manage obstetric emergencies. The program is supported by WHO, National Health Department, and funding support from ADB, or Asian Development Bank, Health Sector Services Development Project. The WHO and HSSDP team recently conducted EMOC training to our health workers in the first week of March. We aim to reduce maternal deaths to zero in the next 24 months. Mr. Speaker, the hospital, medical, and clinical services is another critical component of healthcare. There has been a lot of critics towards our hospitals, but the CEOs and their senior management teams are doing all they can to maintain the operations of the hospitals with limited resources. Buka Hospital operates on an annual budget of over 10 million for operational expenditures and personal emoluments, which is provided by the national government. While Araba Hospital budget is about 5 million, however, they are allocated 300,000 each annually in the ABG budget. While the funding allocation is insufficient to operate a hospital, they are still functional and the department is providing additional operational support from its allocation and from external funding. The department is allocated 20 million to Buka Hospital from the 70 million budgeted for the specialist referral hospital in an effort to improve Buka Hospital in North while we develop the referral hospital in Araba gradually. Mr. Speaker, providing quality health services requires well-maintained health infrastructures. My ministry and department is doing all we can to improve the infrastructures to support delivery of health services. In 2023, the School of Nursing new building was completed and commissioned in December. The new Bolawe Health Center was also completed and opened in December 2023. Refurbishment and improvement of other health centers are being done with support from the constituency members in consultation with the department and Department of Technical Services. Other new district hospitals will soon be constructed with support from development partners like Kunwa Health Center. The groundbreaking will be next in the month of April due to this week's meeting that has been postponed to April. And the project for our level 4 district hospital, Buin, the tender will be out in September. In conclusion, Mr. Speaker, the department is working on a couple of policies. This includes WAS policy, medical drugs and supplies policy, primary healthcare promotion and prevention policy. The health secretary is currently in Singapore with other health professionals to meet with the Singapore Health Promotion Board to discuss how health promotion can be strengthened in PNG and including Bougainville. The department is also working on the legislation to draw down the hospital powers and functions, the procurement function, and will also review and amend the Bougainville Health Administration Act 2017. Thank you, Mr. Speaker.
Leader of Government Business.
Thank you, Mr. Speaker. Mr. Speaker, I move that the House take note of the statement by the